72-year-old woman presents to the emergency department complaining of left gluteal pain for the last 3 months. The onset of pain was gradual, and she does not recall any trauma to the region. She describes the pain as a sharp and progressive and radiating down the posterior left thigh to the level of the knee. She is a non-smoker without a history of anticoagulant therapy. Her past medical history is significant for peripheral vascular disease, hypertension, and hyperlipidemia. The physical examination focusing on the left gluteal region reveals atrophy and muscle weakness. The blood count, blood cell count, and the blood chemistry panel, they are all within normal limits. The suspected embolus was confirmed with a pelvic CT scan demonstrating a heterogeneously enhanced blockage in the deep branch of the superior gluteal artery. The patient underwent an uneventful superselective embolization and recovered well. Complete occlusion of this artery may cause muscle ischemia and atrophy that would compromise the ability to perform which of the following actions. Options: rising from a sitting position, walking, climbing stairs, standing, and running. No trauma, it has been gradual, it's sharp, radiating down the posterior left thigh to the level of the knee, non-smoker. No history of any anticoagulation, but history of peripheral vascular disease, hypertension, hyperlipidemia, fine. And she has been having a thrombus, a blockage in the deep branch of superior gluteal artery. Okay. They already treated this patient. Okay, this patient has been having like a vascular disease. She has peripheral vascular disease, hypertension, and hyperlipidemia that made her susceptible to thrombus or a thromboembolic phenomenon. Okay, and that's why she has been having a blockage in the deep branch of the superior gluteal artery that is causing all her symptoms. And she has also been treated. They did the super selective embolization and she has recovered well. The question is, if there was a complete occlusion of this artery, it would have caused muscle ischemia and atrophy, right? Now, if you had muscle ischemia and atrophy of the muscle that was innervated, supplied by the superior gluteal artery, then what function would have been compromised in this patient? Okay, so first of all, we have to know this artery supplies which muscle. Okay, so patient is having embolus to the deep branch of the superior gluteal artery, and that kind of supplies the gluteus maximus muscle, gluteus medius muscle, and gluteus medius is involved in walking and climbing stairs, as we mentioned before, right? Now, medius and minimus, they are supplied by the superior gluteal nerve as well, we mentioned before, and it also stabilizes the pelvis during walking. Okay. Now, the other options such as rising from a sitting position and standing, both of these are kind of done by gluteus maximus muscle, right? And gluteus maximus is supplied by the superficial branch of superior and inferior gluteal arteries. Okay. And gluteus maximus can also do climbing and climbing stairs and running, because it also causes the extension of your thigh and the lateral rotation. So that will help you kind of run and climb stairs as well. Yes, if you have gluteus medius and minimus being involved, then that can cause Trendelenburg sign positive. Okay, so the answer is walking.
Thanks for watching. Please give a thumbs up and subscribe for more.